Eastman is really the centerpiece of what my education, my life has been.
I grew as a dentist because of the amazing faculty members. I found who I am as a practitioner.
Melpot, a highly standard care to patients, community service.
Well, what sets Eastman apart from other institutions? Intellectually, how the thing was funded initially by George Eastman to take care of the indigent children of Rochester. That was breathtakingly advanced thinking at the time. It was very progressive, and it led to progressive thinking in the lifeblood of the institution.
After he founded the Rochester Dental Dispensary, George Eastman, along with John D. Rockefeller,
donated $9 million to establish the University of Rochester School of Medicine and Dentistry, where the dental research program began.
It started with a group of fellows dentists who were residents at the Eastman and would conduct research, take classes, and work on master's degrees. And many prominent people became deans, world leaders in oral health research, academic leaders.
Dr. Michael Bonacore is just one example of the many innovators and leaders Eastman became known for worldwide.
He pioneered the technique called acid etching, which is the basis for successful placement
of composites, sealants, orthodontic brackets, crowns, and veneers.
That technique has truly revolutionized the field of dentistry.
Eastman Dental quickly became well known in education and clinical practice after being selected in the mid-80s
as one of the first few centers in North America to clinically test the new and emerging dental implants. This testing was the basis for their widespread success.
We train future leaders, and we do this by combining more sophisticated clinical training programs with graduate training to the master's and PhD level. And in this way, they become extraordinarily valuable when they leave here so that they can make an impact on their own institutions, no matter where it is in the world.
At Eastman, there were no undergraduates. They had all the time to work with us individually. The faculty devoted all their time to us, and we got better because of it.
So our residents are always with us in the operating room, and this is a great experience for them to learn how to function in a hospital setting, how to interact with other medical professionals, physicians, anesthesiologists, nurses, and take care of patients.
I was looking for a place that I can work as a scientist and a dentist as well. So the Eastman School, it's a worldwide recognized and famous school for a special program for dentists like me who wants to do something more, something else than just to be part of the research or just to be part of the clinical. I am surrounded with internationally acknowledged and influential scientists, and we are working on very critical topics for the dental science. It is inspiring to be here. Probably would not be possible for me any other place in the world. And only here, Eastman.
I started making nasoalveolar molding for these children. There's so many other residencies that don't even come close to getting this training.
You have so many faculties, they are so well trained. You don't do things only in one way, but it's different ways to get to the same end.
What we are doing at Eastman Institute is way beyond basics. We are improving the quality of lives.
We aspire to be a national leader in treating children and young adults with intellectual developmental disabilities. It's really been a major priority for the institution.
Our rich history of international influence and collaboration is demonstrated not only through our alumni who come from all over the world,
but through our training and exchange programs with universities in China, Poland, Italy, Kuwait, and Saudi Arabia.
Basic and clinical research, postdoctoral dental education and clinical care have cooperated within academic dentistry for many years. However, these entities largely functioned independently. The merger of Eastman Dental Center to the university in 1997 was the start of a more formal linkage, which culminated, together with unitary leadership, in the establishment of the Eastman Institute for Oral Health. This is the contemporary realization of George Eastman's vision of dentistry as a vital and integral part of the university and the community, allowing it to maintain and enhance its role as a leader in academic dentistry in the US and in the world.
Eastman Institute for Oral Health has consistently been among the top NIH-funded programs, due to several multi-million-dollar grants.
The main areas of research include infectious diseases, skeletal, alveolar and dental tissue regeneration, craniofacial development,
periodontal diagnosis and therapy, environmental agents, salivary diagnostics, early childhood caries.
Clinical research, including implants, materials, lasers, orofacial pain,
nerve injury and pain modulation, and dental practice-based research.
Our research programs really have to encompass a broad constituency. There are areas like oral cancer, infectious disease, even what we're doing in terms of biomedical engineering, in which there'll be very important collaborations between dentistry and medicine. And having the Eastman Institute on site allows us to make the most of these collaborations.
We are passionate about providing the highest level of care to each and everyone, from the underprivileged to the medically complex, and we are teaching the next generation to do the same.
Eastman teach you both sides, how to be a very good practitioner, a good clinician, but also have a heart for what you do and do with all you have.
Taking advantage of all the resources and talent that Eastman Institute and the Medical Center have. General dentists, researchers, and specialists from all the disciplines of dentistry work closely together to provide patients with oral and systemic diseases the optimal care. We can and we will make the next 100 years even better.
I, in a very sincere way, love giving back to Eastman because it's why I am where I am, and it's done everything for me and my family and all the communities that I've tried to touch.
I have so much to be thankful, I can't be on and talk about all day long. That's a great place.